Why does my baby feels hot to touch but have no fever? Why is my newborn sleeping all day? Why does my baby spits up after every feed? These are not random questions. These are the questions parents ask me every single day. Hi, I'm Dr. Hamayat Zahid, a pharmacist and the founder of Step by Step Parenting. Today I'm answering parents' most searched baby health questions so you know what's normal, what's not, and when to seek medical help. Okay, question number one. My baby feels hot to touch but doesn't have a fever. Should I worry? Okay, so what this science says, newborn have an immature temperature regulation system, so their skin can feel hot even if the body temperature is normal. What's normal? That when the baby is overbundled, their skin can feel warm, or the room is warm, or you have done skin to skin contact, or if the baby rectal temperature is 38 degree centigrade. When to worry? If temperature is greater than 38 degrees centigrade rectally and baby is lethargic, not feeding and floppy. Medical emergency. If the baby less than 3 months have fever, it's always a medical emergency. Secondly, fever that is combined with poor feeding and difficulty in breathing. Okay, question number two. My baby sneezes a lot. Is it cold or allergy? What does science says? Newborn sneezes a lot to basically clear the dust, mucus, or milk or any amniotic fluid remnants. This is a protective reflux and not illness. What's normal? Sneezing without fever, clear nose, and no difficulty in breathing, and feeding well. When to worry? If baby also have a fever with sneezing and thick mucus discharge and baby is not feeding very well. Medical emergency is when baby has difficulty in breathing, blue lips or chest retraction. Okay, question number three is my baby grunts, strain or turn red while pooping. Basically, this is called infant dysphagia, which is basically babies doesn't have yet learned how to coordinate between abdominal pressure and pelvic relaxation. What's normal? Basically, they are grunting, straining, or turning red to pass the stool, or and they have soft stools. Okay, baby is not constipated if they are passing stool regularly and their stool is soft. When to worry? When they are passing hard, pellet-like stool and blood in stool. Medical emergency is when they are not passing stool for many days and they are vomiting and have distension. My baby has loose stools. Is it diarrhea? So basically, breastfeed babies can pass diarrhea-like loose stools and frequently, and the color also vary, mustard or greenish or yellowish, like that. It's totally normal. These are the signs of diarrhea. Basically, the frequency is suddenly increased, more than 7 to 8 stools, and the stools are more watery, and they are showing the signs of dehydration as well. My baby cries a lot. Is it colic or something serious? So basically, crying peak at around 6 to 8 weeks, and this is normal neurological development. Okay, what is normal? Evening fussiness, which is also known as witching hour, and consolable crying. Like baby will stop crying if you pick them up or shush them around or give them feeds or make them sleep. When to worry? Crying with fever and high pitched scream that you obviously understand that baby is in pain. Okay. So question number six is, why is my baby breathing fast or making noises? So newborn have irregular breathing pattern, which is also known as periodic breathing. What's normal? That your baby does a brief pause and no color change. When to worry? If your baby has chest retraction and persistent fast breathing. Medical emergency is when your baby have blue lips and is grunting. Question number seven, my baby is vomiting. How do I know if it's serious? Okay, milk overflow after feeding is quite normal. What's not normal is baby is having lethargy with vomiting and signs of dehydration. When to seek medical help? If your baby is having projectile vomiting, bile stain vomit, or blood in vomit. Okay, question number eight, why does my baby spits up so much after feeding? What does science says? Most babies have physiological reflux because of their immature LES, lower esophageal sphincter. What's normal? Small, effortless spit ups, no pain during feeding, and baby is gaining good weight. When to worry? If baby is having poor weight gain and cries during feeding. When to seek medical help? If baby has green or yellow vomit and baby is projectile vomiting. Okay, so question number nine, why is my baby not feeding properly today? What the science says? Feeding can fluctuate during growth spurts, gas, overstimulation, or any illness. What's normal? Having short, frequent feeding during growth spurts, cluster feeding phases, and mild fussiness. When to worry? If baby has been refusing feeds for more than 8 hours and having less than 6 wet diapers after day 5 of birth. Medical emergency if baby is showing signs of dehydration, sunken fontanelle, and dry mouth. Okay, so question number 10, is it normal for my newborn to sleep all day? So basically, newborn can sleep up to 18 hours, 14 to 18 hours per day because brain development happens during sleep. What's normal? If baby is waking up for feeds, having short wake windows and feeding well and having good wet diaper output. When to worry: if baby doesn't wake up for feeds, having weak cry and poor weight gain. Medical emergency is when baby is difficult to arouse, you're trying to waking them up but they're not waking up and they're missing multiple feeds throughout the day. Most baby symptoms are normal developmental phases, but knowing when to worry can save lives. Save this video, share it with a new parent, and if you want personalized guidance, my one-on-one sessions are linked below.